everyone, I'm Dr. Laletha from Careclinics. I'm actually a resident doctor from Klinik Damai, Sungai, Buloh. Alright, today I'm going to talk about a very favorite topic for all of us, which is dengue fever. Okay, what is dengue fever? Dengue fever is actually a viral infection which is caused by 4 types of serotypes, okay, which is Dengue 1, 2, 3 and 4, and it belongs to the Flaviviridae family. Alright, the viruses are transmitted through the bite of infected Aedes albopicus and Aedes aegypti, okay, and basically it's from the female mosquito. Okay, before we go into the topic more, I want to know, do you all know where this dengue started? From where it started and when it came to Malaysia? Alright, so let's get to know a little bit about dengue fever, history of dengue fever. So the origin term of dengue traced to the Swahili word for the disease is Kidinga Pepo. Swahili is actually a language from Africa, and if you see, there was an outbreak in Cuba in 1928. That's when we all accepted the word dengue. Alright, and when it came to Southeast Asia, somewhere around 1950s. Alright, 1950s, that's when even the first hemorrhagic fever, first dengue hemorrhagic fever is also started from 1950s onwards, which is in Thailand. Alright, hence it spread into all parts of the Asia. Alright, so when it came to Malaysia, the first cases reported in Malaysia in 1902, which was in Penang, and the first dengue hemorrhagic fever, which is a very dangerous type of dengue fever, was reported in 1962. So that's when we started to have dengue fever. Alright, if you see in 1970s, we already have dengue in Kuala Lumpur, in Penang, and all over in Malaysia, and it has been a very major big problem for us because of our urbanization and of course of our modernization. Alright, so after this, I want you all to know, do you all think dengue spreads? Is dengue contagious? That means if somebody has dengue, if you touch them, do you think you can get dengue? No. Dengue doesn't spread like that. Okay? Dengue has to be from an infected mosquito to a human. Okay? It has to be starts from human, mosquito to a human. Alright? So basically, based on the duration, dengue fever can be classified into 3 phases. The first one is febrile phase. The febrile phase basically lasts from day 1 to day 3, and it is where patient will be having high fever with dehydration. And if you see the full blood count during this time, the platelet will be high and the hematocrit level will be low. And the next phase is critical phase, and also known as defervescent phase. Alright, what is defervescent? Defervescent, that means the fever is coming down already. Okay, this is where everybody makes mistake. When people think that no more fever and they think that I'm already out of dengue fever. That's wrong. Whenever you enter into defervescent phase, that's when you have to be very careful. That's why we name it as even critical phase. Alright? Why you have to be very careful? Because this is where you can have bleeding, you can have organ impairment, and also you can lead into shock. Alright? The third phase is recovery phase. Recovery phase basically is from day 6 onwards, and this is when you recover and you can see a hematocrit level will be going down back again and the platelet level will be going up. Alright? Alright, so now we're going to talk about what are the symptoms of dengue fever. Alright, basically symptoms of dengue fever, you need to have fever obviously, and second thing is retroorbital pain, that means pain behind the eyeball, body pain, joint pains, and you can have rashes, and also can have bleeding, abdominal pain, diarrhea, and also they can have a bleeding stool. Alright, so these are the symptoms of dengue fever. Okay, what is the warning signs? What are the warning signs that you all have to look for? Okay, basically the warning signs, the first warning sign is bleeding. Wherever you have bleeding, please seek for treatment. Alright, you can have any red spots, pethaches on the skin, or you can have bleeding from gums, bleeding from nose, or you can have blood vomiting, you can have blood in your stool, and also you can have heavy menstruation or vaginal bleeding. So please look into it. And sometimes you also can have a frequent vomiting, a severe abdominal pain, difficulty in breathing, and sometimes you can also have pale, cold, clammy skin. So these are the symptoms, basically a warning signs of dengue fever. Alright. Okay, these are the little information about dengue fever. If you all have any questions further, you can come to Klinik Damai Sungai Buloh and to meet me. My name is Dr. Laletha. And if you have any other topics that you all want me to talk, or any other doctors to talk about it, you can comment below. Alright? And please don't forget to subscribe. Thank you.